2.
Good morning, class. I'm so sorry that I couldn't be there today. I will be gone at this conference until this next week. However, I did want to put a quick demonstration together for you. Our next chapter in the book is CPR, and so I asked a couple friends here to help me just do a quick demo on how to do CPR. So right over here, this is Leslie. She is a registered EMT and a registered nurse, and she is going to kind of walk you through the different steps for it. This is Brad. He is going to be our victim today, and I'm just going to turn the time over to you.
Great, thanks Kelly. Hi, I'm glad to be here and happy to help you. My name is Leslie. I'm an RN and I'm also an EMT. I've worked on several ambulance crews, and I'm just wanting to give you some of the basics on CPR and how to help save someone's life. First of all, we're going to have our victim come down here. Most of the time, when you find someone who's unconscious, there's not going to be any identification on them, and you're not going to really know what their needs are. So, you're going to come down and you're going to try and get your patient's attention. Hello? Hello? Can you hear me? Hello? If you can't, you're obviously going to know that there's something more wrong than them just lying on the ground. If you have someone nearby, you need to make sure that you point to a certain person and call them out and say, I need you to call 911. Make sure that they give you confirmation that they're going to do so. Otherwise, if you call out into a crowd, sometimes the phone call doesn't get made and help doesn't arrive when you need it. Second, when you've determined that the patient is going to be having problems and that you need to do something, you're going to be looking for your ABCs: airway, breathing, and circulation. Those are the three things that you're going to be looking for in your patient. First off, your airway, meaning that your mouth or your nose is leading into your lungs. You're going to do a head tilt chin lift maneuver. Tilt the head back like this, and then make sure that their jaw is thrust forward so that their mouth can be open and their airway is available to them. If they have something lodged in their throat, this position is more likely to dislodge the object. Then you're going to be listening for breathing. First off, you're going to use your fingers here and see if you can feel any breath coming from their mouth. You're also going to be looking to see if there's any movement in their throat. Second, you're going to place your hand on their chest and you're going to see if you can feel any rising and falling of their chest. That's when you're checking for breathing. If this isn't happening, your next thing that you're going to be looking for is circulation, because it's very possible that their heart has stopped. Normally, when you're in a doctor's office, you're going to be seeing a pulse be taken on their wrist here. However, when someone is having a major problem like this, they may not have a pulse in their distal extremities. You're going to be checking their carotid pulse, which is right here. You're going to be using your two fingers, like so, because your thumb actually has its own pulse. Your thumb has its own pulse, and if you try to use your thumb to check a pulse, you may be feeling your own rather than the patient's. Now, if you've determined that there is no circulation, no breathing, and their airway is clear from what you can tell, then you're going to be starting CPR. What you're going to be doing is you're going to find the central median area of their rib cage, and you're going to find their left-hand side, which is where their heart is in their chest. You're going to be taking your fingers and interlocking them like this, and you're going to use the palm of your hand here to do the compressions on their chest. One thing you have to remember when you're doing these compressions is we're not going to be doing them like this, bending our elbows as you'll see on TV, because your rib cage is meant to be protective to your lungs and your heart. It's very sturdy, and if you're not doing the compressions hard enough, you're not going to be pushing down the heart to pump the blood to the rest of the body. You're going to want to make sure that when you do your placement here, your elbows are locked tightly and that you are standing like this with your knees to give you a good support base as you're doing your compressions. Then you're going to be doing 30 compressions to 2 breaths with your rotation. If you're uncomfortable with doing the breathing, then feel free to only do the compressions. That's something that the American Heart Association has told us. It's available, and it could save someone's life if you're not comfortable with doing the entire procedure. As you're doing your procedure here, you're going to make sure that you're counting out loud. Most people would say that as they're doing this, you're going to be doing it to the rhythm of staying alive. Staying alive, staying alive. Ha, 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 ha. Make sure that as you're doing this, you're doing your 30 compressions, and then after you've done those, you want to check their breathing to see if they've started breathing, and you're also going to want to check their pulse to see if their circulation has started again. These are some of the basics, and hopefully you'll be able to use them in your future and saving people's lives.
Thank you so much for that, Leslie and Brad.
Very welcome.
All right, class, that was the quick demonstration for you. Miss Hill has the rest of the instructions for you, so just pay attention, follow her, and make sure you are good for her, or I will get upset with you when I get back next week. I hope you guys have a great rest of the week, and I will see you next time.